I mean, of course I was surprised. Nobody expects to get an award like this.
I was absolutely staggered when you called.
The 2015 Hastings Center Cunniff-Dixon Physician Award.
This means so much.
That was really the highlight of the day.
What distinguishes them is their compassion, their spirituality, and their ability to communicate with people who really need that communications process.
Palliative care is so important, it's so vital. It's a skill that not only do we need palliative care specialists, but we need everyone to be infused with these skills.
Many institutions and medical communities feel somewhat threatened by palliative care. And I know what that's like because I used to be threatened.
I feel like some of the most amazing experiences, the most positive experiences I have are doing palliative care.
And as I looked at what I really enjoyed in my job, I felt like that is what I love about what I do. I really help people as they figure out, well, what do I want to do? And it's figuring out, where's this person stand? What are they interested in? And then how can I help them get it?
I decided to talk to some people who knew palliative care and ask them, is there a way to do this better? And it just opened up this whole new world, this world of making people feel better.
To take care of our patients who are older, who are frailer, who are sicker, not necessarily dying in any way sense of the word, but giving them those supports that they can continue to live independently and safely without needing to go into some sort of facility. Home-based care it makes sense, I think, from a family perspective and from a quality perspective.
The Hastings Center Cunniff-Dixon Awards recognize excellence in doctoring. These awards really hold up physicians who realize that disease occurs in people and that it is the person with the disease, with the illness, that needs to be cared for.
But he's worked very hard to embrace the most difficult parts of his job, helping families as they lose their children to cancer. Dr. Coronis never left our side, and he's become a special part of our family. Thank you.
Learning that you can treat their diseases and treat their suffering at the same time, and that actually honest, open communication, heartbreaking as it might be, actually is a way of relieving their suffering.
They understand that disease occurs in a person, not in a test tube, and it's not a bunch of molecules, but it's actually the impact of an illness on the person that they're responsible for caring for, and that then manifests itself in how they effectively communicate with the patient and their family, how they actually sometimes even take on roles not just as professionals but as friends and as a fellow human being who's walking a journey with their patient through this illness experience. And this is really powerful and inspiring.
Anybody who knows how to spell palliative knows that Diane Meyer is one of the truly foundational figures. To have all of these nominations vetted by that group of 4 esteemed, highly regarded physicians, and to be selected for a Hastings Center Cunniff-Dixon Physician Award is in fact a big deal. It is also a big deal because Laura is now joining 28 other recipients of these awards. And that group of recipients truly represents the leadership of palliative care in this country.
So I think as a human being, I have the need to connect with other people and to strive to make people around me better. And that is there when I'm trying to give the best care possible for my patients, because I want to be there for them. I want to help them be the best they can, not only medical care, but helping them find out how that medical care can make the rest of their lives better too.
When you sit down and when you talk with Shada, I think one thing comes incredibly clear is that she is always present. She is the future for how we're going to improve end-of-life care in the U.S., in the world, because it needs to improve, and it's through leadership from people like Shada who are going to make those changes.
It's very hard to explain to people what palliative care is, what the things we do are, how we're not a threat to anybody, that we complement the therapy that's given, that we're not out for control. We just want to help people feel better.
And so I think, you know, as a country, it's something that it's important for us to not be afraid of, to be supportive of, for us to think about what people would want when they're frail and vulnerable, whether it be at the very end of life or earlier in their palliative care experience, to have the courage to have discussions about what matters to us and what we would like our lives to be like.
Patients, they don't know what palliative care is. I mean, the literature bears that out. The average American has no clear knowledge of what palliative care is. So we as physicians have a fantastic opportunity to introduce it in a positive light and to tell patients this is about helping you feel well. This is about helping you live each day as best as it can be, and about helping you make decisions that work for you and for your family.
One of the most important things that we can do as clinicians and providers is educate the next generation of people, and of clinicians, of doctors, nurses, and really get other people inspired and enthused to care for vulnerable people.